Hello, everyone. Welcome to Chapter 1. Chapter 1 involves the introduction of pathophysiology. So, pathophysiology is the study of the functions of the human body in the disease state. Topics in pathophysiology includes etiology, meaning the cause, pathogenesis, clinical manifestation, and treatment implications. So, etiology is the study of causes, reasons for the phenomenon, which identifies causal factors acting in concert that provokes a particular disease or injury. An etiology could be idiopathic. Idiopathic means that the cause is unknown. My medical school professor once said, "We are idiots. That's why we do not know what the cause is." Iatrogenic. Iatrogenic is the cause result from unintended or unwanted medical treatment. It is the side effects of that treatment that causes that specific disease or illness. Risk factor is a factor that, when present, increases the likelihood of disease. Pathogenesis is the development or evolution of the disease from a stimulus to ultimate expression of manifestation of the disease. So, framework for pathophysiology continues. You have the clinical manifestation. You have symptoms. Symptoms are subjective feeling of abnormality in the body. Symptom could be something such as pain, right? Because pain is subjective. One person's pain tolerant might be more than another person's pain tolerant. Therefore, it is a symptom. A sign is objective or observed manifestation of disease. A sign could be, number one, could be a rash. You can't deny there's a rash on the skin. And you have a syndrome. Syndrome is a set of signs and symptoms that consistently occurs together. Stages and clinical courses. The stage of a disease could be a latent period, which is time between exposure of tissue to the injurious agent and first appearance of signs and or symptom. Latent period also refers to a period during an illness when a sign and symptom temporarily become mild or silent. We also have prodromal period, which is the time during which first signs and symptom appears or onset of the disease occurs. We have acute clinical course, which is something that is short-lived and may have severe manifestation. Chronic clinical course may last months to years, sometime following an acute course. Exacerbation is an increase in severity, signs, or symptom. Remission means that the decrease in severity, signs, or symptom and may indicate disease is cured. Convalescence is the stage of recovery after a disease, injury, or surgical procedure. Concepts of normality in health and disease. Individual factor could include cultural consideration, which each culture defines health and illnesses in a manner that reflects their experience. One person's cultural consideration might be different from another person's cultural perspective. So, the other one would be age factor linked. A normal value for a person at one age may not be normal for a person at another age. If you think about this, usually children and adults, they are different. Their heart rates are different, right? So this is one of the example that is considered an age factor linked. Gender differences is relevant in both health and diseases as well. Situational differences determines whether a derivation from normal should be considered abnormal or an adaptation mechanism. Time variation may impact how the body responds from day to night or at varying times. Epidemiology. Epidemiology is the study of pattern of diseases involving population. Epidemiology can be described as endemic, which means it's native to a local region. Epidemic, which means that it spreads to many people at the same time, and pandemic means that it's spread to a large geographical area. The factors affecting pattern of disease could include age, ethnic group, gender, socioeconomic factor or lifestyle consideration, and geographical location. Levels of prevention. There are three levels of prevention. The primary is considered altering susceptibility, reducing exposure for susceptible persons. The secondary considers early detection, screening, and management of the disease. Third level of prevention is rehabilitation, supportive care, reducing disability, and restoring effective functioning following disease. That concludes our chapter 1, and I hope you have a great day. Bye bye.